I've been teaching breastfeeding classes since 2011. I wanted to be able to teach more breastfeeding classes because once I get to moms, the troubles that they get themselves into are things that could have been prevented if they had the information ahead of time. So I feel like if we can get them in pregnancy and give them this information and these tools, they won't allow themselves to get into trouble. So I think that it's really important for moms to get the information ahead of time so they can be better prepared for what's coming. If they went in, thinking I only want to breastfeed for a week, just because you made it or you gave them the tools that they needed, they're able to surpass their breastfeeding goal, or they just wanted to breastfeed for a few months and then they're getting to the year milestone instead of just a few months. So it's a very rewarding job, and it's very cool to see moms do better for their babies and for themselves, because it also protects them. So the most common thing would probably be, do I make enough milk? Or I don't make enough milk. What am I gonna do now? And I think there's just a lot of pressure, especially with social media. You see moms pumping like 6 ounces or 8 ounces, and you're pumping the normal 2 ounces or the 1.5 ounces. That's normal, okay? The 8 ounces and the 10 ounces, it's not common to see that happen. Sometimes they can confuse moms thinking that they don't have enough milk, and it's not true. Seek professional help, not social media. I mean, social media can be helpful, but honestly, somebody who can really sit down and kind of look at the whole picture of your personal situation versus other people's experiences, because lactation can be very unique, specifically if you have any health conditions that are a little bit more specific, or your baby has any health conditions, or your baby has tongue tie. So you should really reach out to a professional to guide you through and see that you do meet your breastfeeding goals. I actually love empowering women, and I love empowering families to make sure that they have the tools that they need to make parenting a lot easier. Babies don't come with a manual. They are just, we are given birth, and 24 hours or 48 hours after the hospital stay, you're sent to go home with this little human that expects you to do everything for them. And it can be really, really stressful to make sure that you are doing what you need to be doing and taking care of all their needs, especially because they don't know how to communicate, or we don't know how to understand their communication just yet. We're still learning as well. So I love empowering families to be like, okay, this is, if he cries like this, or if he cries like that, this is what he needs, or this is what he means, or this is what he needs. And it's very, very empowering to see moms or dads, or specifically when you teach them how to latch without pain, and you're like, wait, all I needed to do was that, change just the angle a little bit to get you out of pain, is very, very rewarding.